Good evening, everyone. Welcome to our live webinar. This is Residence Medical's webinar on what program directors look for in an ERAS application. Thank you for joining in, whether you are here in Los Angeles or joining in from Pakistan, and India, or any other part of the globe. I would like to introduce the Chairman and Chief Academic Officer of Residence Medical, Dr. Michael Everest.
Hi. Thank you, Ms. Sheila Aula. Sheila is our Vice President of Education and Preparation, and she's been with the company for almost a decade, and she's really an integral part of our success. So thank you, Sheila. She's helped a lot of my students achieve their dream residency, including our esteemed Dr. Zane. So I am Dr. Michael Everest. I'm the founder, chairman, and chief academic officer of Residence Medical. What we do here is we have a holistic approach in preparing, educating, and mentoring our students into medical residency and medical fellowship. It's a long, tedious process, especially if you're an international medical graduate, whether you're from the Caribbean, from anywhere around the globe. And we also help U.S. medical graduates, as well as DO graduates, really strengthen their curriculum vitae. We're an education-driven organization that strengthens your curriculum vitae and that really gets you ready to be a competitive candidate, whether you have a past that needs to be overcome or you have a future that needs to be built. Our passion and goals are to make you the strongest viable candidate. So when eyes like Dr. Mudassir's look at you being a program director, they look and see a strong CV. So in that introduction, we founded this company on those goals. The company is over 2 decades old, and we've been around for a long time helping a lot of people. We also start medical residency programs in community-based hospitals. So that's a passion of ours as well. I encourage you to go to our site, residencemedical.com or residencemedicalconsultancy.com if you are a hospital looking for accreditation. In saying that, I would like to introduce someone who has actually became very close to me. His name is Dr. Zane. He is now a successful PGY1 resident in beautiful Florida in the field of family medicine. He came to me, he did everything right. He had extensive research. He was passionate about psychiatry. And he really gave his heart and soul, did the free research, did the free rotations. He had a bit of USMLE setbacks, but he mitigated that. But still, at the end of the day, his year of graduation, his foreign medical status, really, he couldn't break through the barrier because there's just so much competition. Back in the days, back in the 90s, you know, if you knew people in the program and you could work your way into proving yourself, there was much less competition. There was more leeway. Now everything's very corporate. Everything's very committee-based. And he was having that problem. So we took him under our wing, put him in extensive clinical. He had the research, so he did extensive clinical and research in some of the top university-affiliated programs and community-based programs. But lo and behold, due to the sheer competition, he was unable to go through the match, but he never gave up. I personally spoke with him and counseled him. Ms. Aula did, and we encouraged him because we knew he has a talent. Then he followed each and every one of our directions. He was always like, okay, I trust you. I trust in what you're doing because you're making me a better candidate. And he was blessed enough to be offered a off-track position way after the match and after SOAP in family medicine in the program that he was integrated in. Now, we were at a crossroads, and this is where good advice and mentoring comes in. He said, oh, I'm just passionate about psychiatry. But there's always many ways to skin a cat. So now he's in family medicine, and he loves it, and you'll hear from him. Sorry if I'm speaking for you, Dr. Zane, I just wanted to give an introduction. And he has that outlook. He can go into addiction medicine after his residency. So he can still pursue those goals, but he's a resident, and he's training, and he overcame year of graduation and all other obstacles, and he's one of our superstars there. When I talked to his program director, he says, Dr. Zane is wonderful. Find me a few more people like him. So that's really music to my ears. In basically the thousands of candidates that I've helped achieve residency and fellowships, That's what I like to hear. So that is Dr. Zain. And I would like to then introduce someone that's my brother. I call him my brother, Dr. Mudassir. He's program director in one of the most esteemed programs in Florida, a very competitive program. That is, you have to be the top of the top. He is one of the best mentors that my medical students that have rotated around him pre-COVID have had. He takes the time, he talks to them on Saturday afternoon, Sunday morning. He's just a genuinely kind person that cares about academic medicine and gives us all to his students. So he's going to be, you're going to hear firsthand from a program director that what he looks for in an application, in an ERAS application. And we're going to have a conversation back and forth, and then we're going to have strategies on how to mitigate that or how to strengthen it, as I had alluded to at the beginning of the conversation. So without further ado, I'd like to introduce them both. Dr. Zain, you first. Kindly, if you have some words of motivation and inspiration to give to our attendees, please do. And sorry that his picture is not on. He's having some technical problems. He's on calls, so, but you know, you could, you guys email us and we'll send you a picture of Dr. Zain. He's very handsome.
Thank you so much, Dr. Everest. I'm so sorry. I don't know what is the technical fault. You can't see my the video, but I'm really grateful. Thank you, Sheila, as well for getting me into this webinar. So I'm really just thankful for the whole resident medical and everyone for letting my dreams come true. And it's a very good, beautiful journey, the journey of last 10 months, what I spent with the resident medical and the hospital. It was very awesome. And so nothing is impossible to willing heart. I think if everyone just go through and follow the exact right protocol, and everyone can achieve their dreams. So I'm very much satisfied with all the things that I took this route and achieved my goal of residency spot. So now I'm in a very good program in Miami, Florida, in a local community hospital as a PGY1 family medicine intern. And I'm very, very glad that I'm in family medicine. Before that, I was choosing psych and I was having my all CV in psych. But after getting into the family medicine, I'm just loving it. You rotate through all different departments in different specialties for a month, and it's always working with different people of different departments, and it's just awesome. So I'm very, very happy and very glad.
Great. So let's talk about some of the obstacles that you had to overcome, Dr. Zain, and how integrating in the program was really the way to go, you know, from a clinical level, and how you never gave up and how you continued to move forward. Because I remember when I had spoken to you when we first met, it was like, my gosh, what do I do? I've tried everything. I volunteered. I've spent my money. I've followed everything that these chat lines say you do, but it was still coming short. So what inspired you to keep moving forward? And just tell us a little about your journey, please.
Yeah, when I finished my graduation from Pakistan, then I had an opportunity to explore USA because of being a green card holder. So that was my first motivation to get a residency or have a career in USA. So I started preparing for steps after my host job, the intern year in Pakistan, and then I completely finished my steps. But unfortunately, I had some low scores, and so I didn't give up. Like I really want, I have come so far away to achieve my goals. I shouldn't give it. I keep going. And just like as we always heard, read the books that just stay focused, don't give up. I just keep a faith and keep working hard. So I would just think you need a good program where you just work for a certain period of time, that the program knows you, they see you daily basis, you interact with them. So if you get interacted in a good program, chance to work in a hospital environment where you interact with the faculty, you see the patients, you are with them, and they know you, you know them. So if you stay with them for a long period of time, you show the commitment and passion for the work. So then they ultimately see that the spark in you, that you are giving so much of dedication and passion and commitment to a certain thing. So that really helps. Like besides that, like if you are in any other program where first of all, you don't get an opportunity here in USA to work for a long period of time in any hospital. Nowadays, very few hospitals are there like who offer like observerships or externships, and those are even not like, their criteria are different. Some have cutoff scores, some have like a cutoff year of graduation. So these are the issues. So it's very important that you are integrated and doing a research position or a observership or a sub internship in a program where you are meeting the criteria, and where they oblige you that after showing the commitment and passion for a time frame, they appreciate your efforts, and they oblige you with the position. So in my case, that's what happens with me in my program, that I was there for a whole 10 months, and I showed up them like my efforts, my commitment. I've been in the grand rounds, I've been in the hospital rotations, I did share some publications. I have 2 publications which I share, which I publish in the 10 months time frame. So they know me very well throughout the time that this guy is here for the last 10 months, and he dedicated his time. And so there was no problem. Like by the time I had an interview, we are like a family. So they know me, everything about me, I know everything about them. So there was not an issue, and it was very easy for them. Like there was no issue that like for them even to take me. So they whenever I got a the PJY1 position was open, my research director recommended my name, that this guy was here for a long period of time, and he's the best candidate to be for this position, and they just took me afterwards. I cannot hear you, Dr. Everest, sorry.
How about now?
Yeah, I can hear you.
Great, thank you. So no, I said very well said, Dr. Zain. Thank you so much. And now I want to introduce our very special guest and my dear friend, Dr. Mudassir. Kindly tell us a little about yourself and the struggles that you see in these just overwhelming amount of applicants. And then we'll talk about some of the stuff that you look for in an ERAS application and how to strengthen that. So please, sir.
So thank you, Dr. Everest. You're my brother, like you introduced me. So I'm so honored to be here. And you know, whenever I can do whatever can help, if you can make a difference, why not? So starting from the back, I wish when I was a resident, I had some, you know, mentorship or guidance like you guys have created. Back in the day, there was nothing. Okay, I'm not talking about. I'm just talking about 15, 16 years ago. So it's tough. Whoever is listening, whoever is out there, you know, I give you my personal example that don't, like, you know, Dr. Zain was saying, don't get disheartened. Dr. Everest, we never talked about this. I did not get matched. I did not have the right to guidance. I, applied to the wrong program. I never got matched. I had one interview post-match, and that's how I got in. And look, by the grace of God, where I am. One match. So it takes only one. It takes only one. Okay. It takes only one interview. So I've been a program director for the past 10 years. I've been in my current program for the past 3 years. Sorry, 7 years actually. What am I saying? 3 years. The previous one, 7 run right now. So yes, it's overwhelming that, you know, when you get 3,000 or 4,000 applications, you know, for each program. So when the program started, I had to I reviewed all those 4,000 applications, but that was just a killer. So then you had to, you know, I don't know whether everybody knows that we use some filters to filter it down. And that's when, unfortunately, you know, because on an ERAS, I cannot tell what the personality of the person is. It's just a paper, it's just a bunch of numbers, it's just a number of numerics which tell me what was the year of graduation, what is the pass score, and unfortunately this the system is, so you have to work with it. Now, like you said, there are multiple ways how to, you know, augment your application, how to make yourself more visible in front of the program, and how to increase your chances. So we will go over that. I'm sure you're going to ask me that question. So whatever questions you have, sir, you go, and I'll break it down one at a time.
Great, great. Thank you so much, Dr. Mudassir. So the first question I have is, now that COVID is here and a lot of these clinical experiences are done, I want to really differentiate and emphasize the importance of U.S. clinical experience and what type. What I found through my expertise and through the leaders as yourself, we discuss over tea, you know, when we're discussing things, is a hands-on clinical is very important. Observerships are really not considered a litmus test of how strong a person will be. So we really emphasize getting somewhere where you can get hands-on clinical. And our strategy mainly is, and we've had to adjust it, but we've been one of the only organizations that continue to do program integration. What does that mean? Have the student, like Dr. Zain, go into the program where we're hoping he will display talent that they will like. It's all merit-based, and that he will go and show how he is clinically. First one to get there, last one to leave, work hard, show critical thinking, medical knowledge. So the question I have is, what do you see in an application when you have, let's say, a dicto to dicto, same type of applicant, but one has extensive observership, shadowing, and one has less U.S. clinical experience, but it's truly externship, hands-on. How do you differentiate that when you look at an application?
All right, so yeah, great question. So being a foreign medical graduate myself, okay, so I know the issues, what's going on currently with, you know, COVID and all these restrictions, and as program directors we acknowledge that. We know what it is, what out there. But see, the problem is for you know, foreign medical graduates, it's the system, and the best way to learn the system is to be in the system. If you can observe, okay, that's better than anybody who doesn't have any observerships, because at least that person had some taste of the, you know, the system, how the system medicine works over here. But a person who's got you know, hands-on experience, the person who's presenting at the bedside, the person who can take an H&P given to the way that it's supposed to be done in US med schools, they know how it's done, they know how the system works, they know how to, you know, use the medical slangs, which, you know, as foreign medical graduates, that's just exotic terms. Those are exotic terms to us. So there is a learning curve. Don't get me wrong. There is a learning curve. But if you can do that, if you can spend that learning curve, you know, like you said, in a hands-on experience place, or like in some externship, that's a huge edge. That's a huge edge, because that drives you way forward. Because when I look at that, I know that I don't have to, because he's a foreign medical graduate, it's already at the back of mind that the first 3 months are just going to be train him how to talk American medicine. That's what it is basically. Okay, you need to learn how to talk, you know, US medicine. So we know that there's a learning curve, but if somebody comes over it, somebody can overcome it just prior to starting their residency, that's a huge plus. That's a huge plus.
Oh, thank you. Yeah, that's, I mean, the audience, the attendees are getting really some wisdom. And when I preach it, sometimes they don't listen, but when the program director tells them, hopefully it makes the antennas go up. So, and you know, in the NRMP program directors survey, sorry, U.S. clinical experience is the top 5.
Absolutely.
So, and another thing that I'm going from the top, in not particular order, but the 5 that they were looking at in what the program directors gave as a mitigating factor. Having prior knowledge of the candidate. How important is that? Because what I know through my years of experience is I've had high scores that I put in tough competitive fields, integrating them in, is the prior knowledge, especially now with COVID and virtual interviews, the importance of having a prior knowledge of a candidate to see their emotional stability and maturity, to see their sound judgment, their critical thinking skills. How did that help you, Dr. Zane? And when they knew and you could build a rapport with the chairman, with the program director, with the attendings, and having that prior knowledge. Tell me a little about that and how prior knowledge helps. Dr. Zane first, and then if Dr. Madasa, I know you got busy.
Okay. Yes, like, because I think like your board scores or like what they see in your CV, that some like program just like go with that, like okay, this candidate has top scores or like graduation, and they just getting the thinking about the candidate from the papers. But if you have like this low average scores and all your graduation, that's where the things gets difficult. So there the point comes, like when you are physically in a certain program where you are working and showing the dedication, that then they can see that your abilities and your passion and determination, that score is not the only criteria. Like even if the candidate has like low scores, but he or she has the ability to go through like the residency stuff, the candidate has the ability to do all the works what a resident's supposed to do. Like he can see the patients, do the interviews, show the emotional stability, have critical thinking, sound judgment, and have the good medical knowledge. And when they see there are all these aspects in the candidate, so that's overcome all of their negativity about the person. And this is how, like with the passage of time, you also build the rapport with the people, with the staff, with faculty, and overcome all of their reservations, and that helps the candidate to connect with the program. And this is what happened. Like in my case, like I show them my dedication, hard work, like all the sound judgment, that there was no issue. Like when I was working as a sub intern, like I was working just like as a resident and an intern, and the program attendings, director, everyone is looking at that this guy has like all the basic knowledge and skills to be a resident, and afterwards they don't have any hesitation that to pick me up. So that's what I think, like that the only way that you show your dedication, if you're working as a long-term candidate in a program, show your dedication, show your commitment, show your passion, work hard, and follow all the commands of your seniors. And so if you do all these things, like I don't think so there should be any issue.
Very well said. You want to chime in, kindly, Dr. Madasa? And
Yes,
how that prior knowledge helps deciphering.
Absolutely. I will give you a few examples as well. So I mean, I have, again, this is pre-COVID era. So I don't have a COVID example right now because residents were restricting in seeing COVID patients. So talk about what you call observers or externals. But we had two very weak candidates. I mean, weak in a way that they had weak scores. So one was two were at my previous institute and one was at my current one. So they came in and they found about the program, and you can have only two, one observer per attending. That's what our rule is in our hospital. So I allowed that girl to round with me and to see. So I could see, I was a junior faculty at that time, so I saw her zeal. Like you said, she was the first one in and she was the last person to go. She was doing everything more than the residents were doing. She was following up on and she was following up on whatever the residents want. She used to take call with the residents as well, because she said, I'll stay with them just to see how admissions are done, and only when the residents let me go, I'll go. So she used to stay late in the hospital. Even the rounds are done, she says, no, I just want to see how the system is. And she was helping with me research as well. So when the time came, for the interview season came, I went to my program director to tell her. So, and I asked her, I asked him, listen, don't look at the, scores. Trust me, I've worked with this person. She is way better. And she said, okay, I will review it. So that's where the interview skills comes in as well. So the residents, they helped her with the interview. I couldn't do that. So she get a very good interview, and she was in our program. Her scores were, like I said, weak, but she passed the boards on the first attempt because she had that zeal. She was given mentorship and all that. Similarly, you fast forward through 2-3 years over here. When I came over here, I had one candidate. First year, he was doing okay, so not too good. So I said, sorry, my faculty and we decided that, okay, he's good, but we have tons of better than, why take him? So, but the clincher was when we did not take him, he came in the next day and he said, I'd like to continue my research and my rounds with you. So I asked him, I said, I'm amazed that you came back because we did not take you. He says, no, I still want to continue, I still want to learn. So that was a big factor for all of us. This guy, 1 year, spent all his days and nights with us. Still, he didn't get matched, but comes back to see us again. That tells you about the character and the zeal and the passion that a person has for medicine. And the next year we took him, and now he has passed his board and is a practicing hospitalist.
What beautiful examples of perseverance. Yeah. When you eat and sleep medicine, you can't give up. That's and really going to the interview skills is so important that you actually, especially now with these virtual interviews, your lighting is good. You're always dressed right for an interview because your first impression is everything. Usually,
absolutely. I wish you guys are doing something because virtual interview is a completely different ball game. Completely different ball game from being in person.
Yes. No. Yeah. We totally prepare them for the virtual just by lighting and going through these different questions, almost through like the Casper exam questions, and really getting to know the residency readiness because you only have a few minutes to impress people, and practice and just feeling confident. I know everyone, people get nervous and this and that, but you have to be confident and practice is important. So interview skills and the post-interview. There's rules and regulations in that RMP, but you can send a thank you note. And that shows that, hey, this person is really, really loving. Don't make it a long paragraph, just a few sentences, send it to the coordinator, or if the program director gives you his credentials, you can send it to him. But to follow up, because just like when you're in a corporate area, when we're reviewing applicants for a job, the ones we interview and we don't hear back from, we're like, okay, but the ones we hear back from and there's some line that shows, wait, this person has some factor that we like, that they're in our mind, they're fresh in our mind. So the follow-up in life, just as it is in this interview, follow-up is very important, I think.
Yes, you hit a bullseye with this. So a lot of residents, they forget how to follow up because it's the culture, right? It's the culture. They don't know how to follow up. So you brought up two very good points, and I'll tell that. And now I'm giving you the the insight, I would say, scoop. So always the person who runs the program is the coordinator. Know her name and send her a nice thank you card. There are always residents who are assigned to, especially in the virtual interview, they're assigned to, guide you, answer your questions, basically entertain you. Know their names, write down their names, send them, a nice thank you card as well. Because as a program director, I take feedback after the interview from my coordinator, from the residents, and obviously from the faculty as well. So don't forget the residents, they are there, they spent their time. Send them a thank you card as well, or a nice, email. Hey, it was a beautiful experience. There's so many way to do that, so I don't want to tell you guys. But the key factor is the coordinator. You got to impress the coordinator during the interview and make sure she remembers you, and make sure you follow up with a nice card. Don't be too cheesy, like a glitter card or a, like a musical card or something. Don't do that. Don't send a box of chocolates. We had that as well, okay? But a nice thank you card to the coordinator and the residents, that's an extra step you will go besides the faculty and the program director.
Wonderful advice, wonderful advice. So I want to end it with one more thing, the importance of ERAS, and probably the most important to get past those filters is for you students that are just getting into MS1, MS2, or even graduates that have done step 1 or step 2. So your scores are very important. That really will, you will overcome obstacles. So let's say some of you have gotten a low step 1 score, or even failed your score. Coming this upcoming year, it'll be a pass or fail, but I still think there'll be a numeric score similar to step 3 attached to it. So it's not just, you know, pass, fail to the degree of, it always has some feedback and breakdown of what, so the thing is let's say you got a low step 1 score, you can fail. You must do better in step 2 and get step 3 out of the way. What a program director will look at again is a forward progression. So you got a 210 on step 1, but if you go and get a 230 on step 2 and you complete your step 3, which I think is almost mandatory for a foreign medical graduate. Dr. Madassa, you can chime in on that. And on top of it, doing the extracurricular stuff, like what we do at Residence Medical for our internal medicine applicants, is they sit on the ITE exam through the hospitals that we have affiliation with, even before they're a resident. Why do they do that? Because if you have low scores on step 1, step 2, or an attempt, and you get an 80%, 70% of your ITE, that shows that you are board readiness and board passing. And what does the program care about the most? They're not going to fall behind and have to babysit a resident, and will they pass their boards? So there's ways to mitigate that. Ideally, if you come to me without taking your steps, we'd prefer to tutor you and get you high scores from the get-go. But if we're having to, you know, rehabilitate your candidacy, there's ways to mitigate that to show an improvement. But work on your board scores. It's not about just passing. It's about knowing it. It's about practicing, having a good study plan. And if you've gotten low scores, then you progress forward by getting better scores. And now more than anything, step 2 is going to be paramount. So those step 2 scores need to be really your gateway in. Any further advice, Dr. Madassa?
Sure. So, I mean, it's the famous saying amongst, you know, all the academic teaching faculty is board scores beget board passing rate. Okay, so there's no doubt multiple studies have shown again and again that the better scores you have, the better chances you'll get scores that you get in IT exam, and the better scores you get in the IT exam, that increases your chances of passing the board on the first attempt, because that's what counts for us. Okay, so you mentioned a very good point, you know, that okay, if we set filters and the individual candidate, he may be good, but unfortunately for some reason, odd reason, could not score well, or some personal tragedy happened, you know, so how to circumvent that? So there are 2 ways to do it, you know, which do it. If you, like you were saying, that, you know, if you are rounding with somebody and they are assistant professors or program directors, or even a hospitalist, if you're, or even an outpatient, you know, attending that you're rounding with, whoever you are, ask them to email for you. Because I will, as a program director, because NRP, you know, now the rules are so strict that if somebody emails you or something, I am not obligated, and I will not answer that email. However, if my colleague or my distant colleague, because even if all of us physicians over here are colleagues, my colleagues, you know, emails me that, you know, from so and so place that, you know, I have this candidate, these are the issues, what happened, but if you can take a look at his application, I would appreciate it. Definitely, I would do that. I would definitely do that. And either I'll do it or my coordinator does it, and we send them a one-liner, I'm sorry, you know, does not qualify for a program, or yes, we will take a look at it and then get back to you guys. So that's one of the ways to circumvent it, that have somebody email on your behalf. And I can give you examples of, you know, how I have residents who, I mean, some of them rotated at very top Ivy League schools, and from there you get a, you know, a numero uno guru of, you know, AFib calling you up that this candidate is good. Obviously, I'm going to listen to that, even if the, you know, scores are bad, because that person has published so many years. But not everybody can get into an Ivy League school for research. Okay, so the best thing is to do that. That's number 1. Approach the program director, approach the faculty through your mentor, through your preceptor. That's better way. Because if you directly approach it, you're going to be violating the NRMP match. If you, God forbid, please physically do not show up to the program. That's the worst thing to do, okay? But you can email the program director. There's no harm, but there's no guarantee that they're going to look at you. The best way to approach this is to ask your mentor or preceptor to email, because you know your program, the application may have already been filtered. Now, if you're, like you said, if your scores are low, then two things, you know, are going to camouflage your scores. Number one is obviously your research and publications, and like Dr. Everest said, step 3.
Absolutely.
These are the two big ones which are going to help you.
Absolutely. That's wonderful advice. Wonderful advice. And I want to run through a couple of stats, and then we'll take a few questions, and then we'll finish it up in the next 5 or 10 minutes. So, ERAS. In the 2021, there were 42,546 total applicants. Out of those, there were 13,238 IMGs. Out of those IMGs, 7,508 matched. That left a pool. This is the main match. Some, you know, did post match and such. This left a pool of 5,730. Now multiply that year after year after year after year. And that's the competition. Back in the days when we were starting off a couple of decades ago, if you were 7 years out of medical school, that was fine. Then it became 5 years. Now it became 3 years. And now some programs just 2 years. So it's the block is getting less and less because there's just too many applicants, so they have to filter it. And then you also have many other ways. There's pre-matches. A pre-match is where you don't go through the NRMP match. There's few programs that do it. You get offered in December, then you have to withdraw the match, and you get your contract and you start in July, I apologize. Then you have the NRMP, the main match, which everyone knows about in March. Then you have post-match, which is now called SOAP. And then after that, you have off-track positions, all the way until July, August, September, even October. Our students are getting interviews and offers because there's residents that quit, there's residents that become pregnant, there's many other factors. So keep yourself relevant. Don't say, oh, I wasn't going to go to the match, I'm depressed, I'm going to go. Stay relevant. Like Dr. Madasa gave that example, that guy came back. Because when an opportunity comes and the person you're with, who is a colleague by definition of the program director, calls and says, look, he's still with me, it shows, wow, this person's not giving up, they're staying busy. So all of these things really, really matter. But at the end of the day, stay relevant. Stay relevant, have the right attitude, because you yourself know your weaknesses when you go to sleep and you're laying in bed saying, why didn't this happen? So you have to figure ways to mitigate it. And that's why organizations like me take great pride and humility, is because we really care about each individual, and we know that you have an MD, you have an MBBS, it didn't come easy. So you had a few obstacles. As long as you're committed and dedicated, opportunity will meet your preparation. So that's really my speech. Let's take a couple of questions, then we'll have some closing comments from both Dr. Zain and Dr. Madasa. We'll give one question, 2 questions each, if you don't mind. Then let's go from there. Do you have any?
So in case you guys know, you can input questions at the bottom of the dashboard.
Let's see.
So Dr. Mudasir, this question says, thank you so much for hosting this webinar. When can we expect interview calls from residency programs this year?
Okay, so remember this year NRP, ERAS opened late. It usually opens on the 10th of September. This time it opened on the 29th. So I'll give you my example. I still haven't reviewed the whole applications yet, so we haven't sent out any interviews so far. So there are some programs who have already sent out interviews, and there are certain programs who are still holding on. We send out interviews till December. We hold, I'm talking about my program, and there are other programs as well. So they sell down in spurts. Sometimes some programs send in the whole bunch. Sometimes they do it. So up till the first week of December, you will be still getting interviews, because till December, then it trickles down, because that's just programs are unwinding. So you may still get a chance of getting an interview till December.
Wonderful. Thank you for that. So Dr. Zain, this next question is for you. How do I overcome a graduation year gap?
To overcome the graduation year gap, there are a lot of programs in all over the USA where there is like they're not strict about the year of graduation. So work out properly, search about the right programs where there is they are flexible with the year of graduation. So even I know many programs where the graduation year cutoff is 10 years, besides 3 years or 5 years. So don't waste your money, don't waste your time in applying to to those programs like where there is a severe strict cutoff. And so just prepare properly and explore all those programs which are flexible with the year of graduation. You can see their website, criterias, go to their resident site and see their profiles. You can easily make a judgment that these programs are flexible and they are not that strict with the year of graduation. So it's just like you have to work out and search properly. So one of the aspect is that, and afterwards, like try to find a good program which is IMG friendly, and try to get into that program as a sub intern, as an observer, or try to find a good research position, and show your dedication and commitment with them. Work with them for a certain time frame, and that's the only way that you can show your skills that even with the older year of graduate you can make up. And if they know you, if the program knows about you, they know about your skills, they know that you have the ability to perform all the duties of a resident in a professional manner, and they know about your personality and everything, so then there will be no issue. And that is the only way that I think the older year of graduation can be overcome.
Yes, you're absolutely right. Just because you have an older year of graduation doesn't mean that you were not clinically relevant. If, let's say, for example, you graduated in 2015, an arbitrary number, but from 2015 on, you have stayed relevant, whether it's research, whether it's externship, whether it's continuously doing something. Back in the days, they used to have something called a PTAL letter in California, post-training authorization letter. So in order to be considered for residency in California, you had to get this letter from the board. And one of the main criteria for that letter was you cannot have more than a 60-day gap from your year of graduation. You have to do something in medicine. So if you do have it and you're constantly going, there'll be one program out there that will say, this person hasn't given up. Great. Why didn't you get in if you answer that properly in your interview skills? But if someone has had graphs and they have a gap and they worked, at Costco for 4 years and now they're getting back in medicine, that doesn't show that zone, that focus, that no matter what, I will do this. Yes, life comes up, but you can always work as a paid researcher, as an MD. There's a lot of things you can do staying in medicine. I have people that have gone on to be nurse practitioners and PAs just to make their ends meet, but always working on residency, but they stayed relevant in medicine. So yeah, just the year of graduation can be an issue if your CV shows that you weren't doing anything, but if you're constantly at it. Dr. Zain, when he came to me, his CV was full. He went to esteemed schools and did research, went to community programs. He stayed relevant. He just needed the right fit. So the next question is, how do I know what specialty to go to? So basically, look, you don't want your CV to have, you did 3 months general surgery, 1 month dermatology, 1 month anesthesiology, 1 month orthopedic, because that doesn't show a focus. Whether you're a hospitalist or internal medicine doctor, whether you're a general surgeon, each specialty's program director has dedicated their life to that specialty. So they want to see that same dedication. I always tell my students, if you chase 2 rabbits, you don't even catch 1. If you have a shotgun approach, it's not going to show a dedication versus if you have a laser approach. Everything is relevant to internal medicine. You did cardiology, you did outpatient, inpatient, but it's always been internal medicine. Then that shows this is what you want, because no specialty, I don't care if you're talking pathology, family medicine, whatever, that program leader, academic medicine person that dedicates his life to that is going to say, oh, he's just coming to me because it's easier to get it. They want to see a dedication in that field. They don't want these kind of burnt out type of people that'll just do anything to take it. You have to have a focus. Any input from you on that, Dr. Mudassir?
Yes, absolutely. I 100% agree with you. You have to have that focus. You have to have that continuity, and you should not have any gaps here and there, like you said. So I couldn't sum it better.
So much. One last question. I think we'll give it to Dr. Mudassir, and then we will have some closing thoughts, and then we'll sign off. Go ahead, please, Sheila.
So what is the best time to send a letter of interest, and what all should we include in a letter of interest?
Alrighty, great question. So you don't want to send it too early, but not too late. So usually, remember before the match order, list is done. So after the week of between the 1 to 2 weeks after your interview, because that's when you are really fresh, you're in the state of mind. Don't send it too close to, the what you call the match order list, because by that time everything is jumbled amongst the program. However, 1 to 2 weeks is ideal, and that's when you send it. Now, and what to include to it. So it depends upon how your interaction was with that individual. Okay, so you like something the program coordinator sent to you. Our program coordinator always closes up. She has a very nice, send off or something. She has very nice closing remarks. So, use that. The residents like to discuss cases, that what sort of pathology they have in the hospital. They like to discuss, rounds or something. So I have that, anecdote, memorize and write it down, that, okay, you know what, Dr. Patel, you mentioned this case to me, and I re-looked into it, and it was very fascinating. And whatever you discussed with the faculty, so a little line or two, which helps you, actually, which reflects me, that as a program director, that you remembered my stuff. Okay, the thing which comes to my mind is I had a resident who was doing research in I would say syncope, specifically with POTS syndrome. So we had a discussion on the POTS syndrome, which is partial orthostatic tachycardic syndrome. So he specifically mentioned those lines. That thank you. That discussion was very relevant. So I remembered him because it's the only one I discussed with him. Then there was a very rare disease one. When I usually ask for your most memorable case. So there was a very rare disease, Fujimoto disease. So that girl specifically emailed me that, or sent me an email that I discussed this case with you to remember me. How could I forget that case? It just clicked right there that, okay, this is the person I want, because we had a good discussion. So little snippets, a little, thing which was interesting during your interview with all the people that you interacted with. That should be included in that thank you follow-up letter.
Wonderful advice, Dr. Mudassir. So now it's time to sign off. So Dr. Zain, if you'll say some closing words of motivation, because most of these people are in the position you were last year, and then you, Dr. Mudassir, and then I'll close up and wish all you guys the best. So please, Dr. Zain.
Yeah, it's the same thing. Motivation. Keep yourself motivated. Nothing is impossible to the willing heart. Just make a right plan, and every candidate should have a plan A, plan B, and plan C. So and stick to that plan, follow it, and have a belief in yourself. Everyone has a certain time. The right time comes. So just be steadfast, show patience, and always be optimistic and positive. At the end of the tunnel, there is a light. Be positive and achieve your goals by showing the commitment and dedication. Don't just get depressed, disheartened if you don't get matched one time, second time, third time, fourth time. I can say in my case, I got matched in my fifth consecutive cycle. So I applied 4 cycles before. All of my class fellows, my colleagues, my close relatives, they discouraged me. They told me so many things, like somebody is asking me, giving me suggestions of that to go for master in public health. Some say go back to Pakistan. So some are saying go back and work in Saudi Arabia, go and do this in Dubai, Abu Dhabi. So I did not hear that to anyone. I just say, no, I want to work in USA. I worked so many years. I worked so hard. I did go through so much sacrifice, and at the end I just give up. No, I don't want to do it. So I just determine myself. I keep showing the courage, keep myself motivated, and go through all the areas wherever I got an opportunity. I worked in at Mount Sinai at Israel. I worked in so many externships in different hospitals, and in 5-6 states I've been working. So at the end, but I got at the right position at the right place, and that's how I got so lucky that that at the end I was at the right place and I was showing my dedication there, and that was my time and I got it. So never ever think negative. There is always a hope. There is always some things. You will always hear different success stories of different people. This is all by, when you are at meeting or you are at the right place. So it's all about your hard work, destiny, and luck. So just keep yourself motivated and never ever depressed or give up. So and my praise and best wishes for all the candidates who are applying, and I hope so they will get in. I cannot hear you, Dr. Everest. So
How about now?
yeah, I can hear you.
Okay.
Yeah.
Yes,
So I want to thank you very much, Dr. Zain. Sorry about, we're going to get this technical stuff fixed. So now, Dr. Madassar, the esteemed Dr. Madassar, if you'd like to say something in closing, and then I'll wrap it up.
Thank you guys for having me. And like I said, I give you my example. Don't get discouraged. I could never face what Zain went through, but I did not get matched. So I didn't get matched. So first of all, I told my parents, and then I went to my research professor that I didn't get matched, but I want to continue my research. He said, you're not going to get paid anything because I don't have anything to pay you. I said, no, I just want research. So, and then I got one interview and he called me up for that. And then, as they say, everything is history, but don't give up. Don't give up. I mean, I have had so many motivated, Dr. Everest, the one motivation factor I'll give you. I have one resident working with me right now who's a 12-year-old graduate. He had nothing. The poor guy, he said, and he said that, I didn't know what to do. So you know what he did? He joined a DO school. He repeated his 3 years of DO school because it's a 4-year DO school. He was already had an MD degree, so they cut us some slack, and he updated his year of graduation, and he scored good, and he got in. I said, why? You could have chosen another career. 12 years is a lifetime, and you did all this. He said, sir, this is all I wanted to do. I did not want to do. I had chance of doing, like Zain was saying, master's in health administration, become a CMO or something like that. I said, no, I want to do this. And he's now my 2nd year medical resident.
Beautiful. And these are such beautiful stories. And everybody, be inspired. Never give up on your dream. And see, Dr. Madassar didn't know about us back then. Dr. Zain did. This is what we do. We help people. Whether we're helping people from Washington University that want to get into tough specialties. We have here to give you the guidance, to help build your CV, to open the doors and give you that audition stage where you go prove yourself. So come to Residence Medical. We can help you. We give free advice too. We have a pathway, a program that helps so that you know that you're not just going and banging your head against the wall. So in closing, be encouraged. If you need any assistance, we're available live chat. And stay tuned. We're going to be doing a podcast coming up soon. And just be encouraged. The competition is fierce. You have to be confident and you have to show hunger, and your opportunity will come. You just have to know when to take it. So thank you, everybody. And Dr. Madassar is a busy program director in the middle of ERAS season, but he took time because he cares about you. Dr. Zain is a 80-hour-a-week PGY1 resident, but he took the time So there's people out there that are caring. Surround yourself with people that are positive people. Nobody wants to be around negative people, and if you're around negative people, negative things will happen. So be encouraged, and reach out to Residence Medical whenever you seem fit, and we can help you too. A lot of our students are getting here. Thank you so much for your time, gentlemen, and God bless you guys.
God bless you.
Thank you so much, Dr. Aravis. Thank you very much.
Good luck to everybody. Thank you.